When you think about a health professional and a patient's relationship, you tend to visualize a professional barrier placed between them. We often place them in a teacher versus student relationship. However, in saying this, patients expect a lot from health professionals. They rely on them. They rely on their services, and they trust them. They trust them with their words, with their questions, and most importantly, they trust them with their privacy regarding their particular conditions. However, keeping this all in mind, it is also important to look at the communication between the health professional and the patient. The ability of the healthcare provider to communicate effectively with the patient is imperative to assist in helping that patient. Patients trust healthcare providers with confidential and intimate information that is essential for their medical diagnosis and appropriate care management. This intimacy allows healthcare providers to prod and poke in the most sensitive of physical and psychological areas. Therefore, in saying this, health professionals need to be proficient at communicating in a variety of styles and given situations. Communication should, first and foremost, be conducted in a spirit of humanity. Delivering communication should be revolved around a patient-centered care. The health professional should use skills such as active listening, empathetic understanding, and most importantly, cultural competence. The goal is to genuinely hear and understand the patient's message, and to acknowledge not only the message they are trying to portray, but to acknowledge the person itself. A study conducted by 3 university students regarding patients' complaints about encounters and communications in healthcare showed that a lack of empathy towards patients' illnesses made them dissatisfied and felt unsupported by their healthcare provider. Now, it's important to note that empathy isn't about feeling sorry for that person or that illness. It's about demonstrating a willingness to explore their concerns and their point of view, and encouraging the patient to fully express themselves and to have their communication needs met. Furthermore, the interaction between the patient and the professional is a two-way street, and the outcome is influenced by a range of different factors. A communication framework described by Feldham Stewart consists of 4 main components that occur between the patient and the health professional during a face-to-face session. The first is solely focusing on the interaction between the two. Although the interaction expectations are mostly met by the health professional, interactions from the patient is also necessary for it to be effective and useful. The second is the patients themselves. Acknowledgement of their needs, skills, values, beliefs, and psychosocial requirements need to be taken into account, as these can ultimately affect communication and the management of that condition. Third is the communication process. This involves how the messages from the health professional are either verbally or non-verbally conveyed, and how they are received by the patient. And fourthly, the environment in which the communication occurs in. Is there privacy when this communication is taking place? Is the door closed? Or can other patients hear what they are discussing? Another imperative issue health professionals tend to come across are cultural differences. Professionals are expected to practice with integrity and personal tolerance, and have the ability to communicate effectively across language, cultural, and situational barriers. In order for health professionals to be culturally competent, it requires going beyond symbolic gestures, beyond the stereotypical connotations, and to seek a clearer understanding of what it means to belong to that culture of the person of who you are interacting with. Once professionals know this, they can then adapt their manner of interaction, as well as their professional services, to that person's needs and background. Last but not least, it is essential for health professionals to take into account that patient's psychosocial requirements. Psychosocial assessment is an imperative part of creating a personally attributed care and management plan. People often present with more than a set of medical problems. It tends to go beyond that, intrinsically. Physiological or social factors may affect their recovery or compliance with treatment. The purpose of this type of assessment is to clearly pinpoint the specific problems in a person's life that may have a physical or psychological impact on their recovery process. If we take a look at Maslow's hierarchy of needs, you have the necessities that come first, such as any physiological needs that need to be taken care of, things such as water, food, shelter, etc. Then you need to look after your safety and security. As we start to move up the pyramid, we begin to move towards more intrinsic factors, such as the need to feel a sense of belonging and the need to feel loved, which then follows for your needs for self-esteem and self-actualization, such as being approved of, or realizing your own potential and creativeness. In regards to patients, let's just say a health professional encounters a patient which can be regarded as a particular population group, such as the elderly. Like children, the well-being of older people can be fundamentally dependent on their family and on community care services. Elderly people may need a range of types of care. Those who are physically independent but have become isolated due to a loss of their partner may need housing within a community where they can develop new relationships and be close to support facilities. Those with physical disabilities may need even greater access to medical facilities and assistance with shopping or any other household activities. Or even those who are severely ill, they may need 24-hour care every day in nursing homes. As well as physical and practical care, older people need to be able to retain their individuality, dignity, and full rights as human beings. And this tends to be minimized or even fully diminished once they enter a nursing home. The quality of care in nursing homes where residents may be unable to assert these rights is an important psychosocial issue that may be hindering their recovery and communication with their health professional. Overall, communication within the health services is both challenging and rewarding, but effective communication between a professional and their patient is an essential aspect for positive change to take place regarding that condition. And lastly, professionals need to be proficient at using a range of communication methods and have the ability to adapt these communication methods to both culture, context, and the people that are involved. Thank you.